be able to start recording.
Okay. All right. Thank you. Okay. The HL7 antitrust policy. Karen, I'll let you go ahead.
All good. So just everybody familiarize yourself with the antitrust policy. And today's agenda is really two parts. So the first is to talk through the care planning track at the Connectathon next week. So Emma can walk through the scenario raw data and talk about some future care team scenarios. And then for the May working group, just talking a little bit more about planning for that with respect to the MCC eCare project. Emma, over to you. I don't know if you want to share your screen to talk through some of the...
Yes, I think it would be easier for me to share my screen. Let me share my screen. And remember, this is meant to be a conversation. So please jump in at any time, give input, feedback. That's what we're seeking. Okay, can you see my screen okay?
Yep.
Okay, so next week we're going to do the technical connectathon, and we're Dave, Karen, myself, patient care is doing the care planning track. And we're using the work that we've been doing with the MCC project for this track. Our focus is on goals. The one thing I want to call out about this track is that the scenario that we're using is the exact same scenario that the patient care work group is using for the clinician on fire track that we're also doing. I think is it next week or the week after, Stephen? I think it's the week after.
It's next week.
Okay. All right. So it's next
Thursday.
Yeah. So it's after Connectathon, but it's next Thursday. And there's a link to the clinician on fire track. And this is where clinicians get together and we apply clinical workflow, clinical situations to the fire resources to determine if it's fit for purpose. And every time we do this, we end up, we submit change requests to HL7. Right, so this use case is actually the same scenario that we're using for clinician on fire. We're focusing on goal, and this is a continuation from the January working group, where we focus on. Now, this time around, we're trying to make sure we can show the linkages between goals and the various interventions. We're also tackling notes, the notes that are captured in the system that are related to goals, you know, how to get that into the fire resource and be able to exchange those types of notes. And as I mentioned, goals with the related interventions, that's another area that we're focusing on. We have some questions and, you know, some workflow that issues that we want to discuss as part of this work. We're also
vinegar
to be able to use
what I called for
and observations to show things that are addressed by goals, because as you know, with the things in the care planning process, there's lots of linkaging going on. We recently drew a JIRA change, got barriers added as an extension to the fire spec, and we're hoping to be able to either discuss that, advertise it, let people know it's there, talk about how barriers, if and how barriers as well as protective factors are captured in systems, and if it's something that they can extract or that will be able to be exchanged. We've had lots of conversations in patient care about goal relationship with other goals, and how, you know, we want to have to demonstrate or talk about how feasible that is if it's something that is captured, you know, and if it is there a way to track them, that kind of conversation. We always put a sort of visual in the scenario just to get people thinking and making sure people are getting used to how care plan, the linkages work as, when it comes to fire resources, and to make sure the data that are in the systems are made available to be able to support these linkages. Sorry, let me go back. How do I exit? How do I get out of here? Okay. I don't want to preview it. I think I have to go back. Oh yeah. And then another part that we're starting, not for disconnected now, but we're having conversations with human and social services and ACF folks about starting to tie in care team. So, and this is what this, so that will also be conversations or discussion during a connectathon as to, and there's another persona that came from the social services side. Our care planning persona up with a caregiver, and because families are interrelated and things like that, and how we can progress using like non-clinical, lay people caregivers, as Russ refers to care teams, some of the care team members, as well as caregivers who are part of the healthcare system and caregivers who are not part of the healthcare system. So that we'll also have that start initiating those conversations. So that's a high level overview as to the track of what we're planning on doing next week. Any questions? And I will, before I start digging into some of the data. Okay, so what I've been doing is, and I won't, because I won't show the scary screen. Well, I've been fixing resources to use at the connected, and this is what this is. So these are the same scenario that I showed you on the Confluence page. This is the data to sort of represent that scenario within the various fire resources. And I'm trying to make sure that we have those linkages so that we don't have to go through JSON. What I did, and Savannah, I'll update the slides with, so what I did was and this is really for discussion purposes. That's the reason why I did this like this. So currently right now in the scenario, Patricia has 3 goals. She has diabetes, of course, and is poorly controlled, and the goal is to stabilize her hemoglobin A1C. So that's one of the first goals. And then because of the linkages, I have goal dot addresses where I'm linking her goal to a condition, her diabetes. And I'm also linking her goal to an observation where the provider has documented that currently right now her diabetes is poorly controlled. One of the things that we've been talking about or thinking about, and this will be part of the conversation, in order to in FHIR, we can also tie goals currently today to service request in order to link the things that are ordered to help make sure this goal gets achieved, or the things that are linked, they're supposed to be done in order for the goals to get achieved, the intervention pieces of it. And then we recently, patient care got a change proposal that was approved to also add procedure as one of the resources that can be referenced by the addresses element. So in order to tie goals to the intervention. So that's why I have it in red, because this is some of the discussion points as to when we go through the whole tying goal to interventions and all those kinds of things. Is this the way in which we should go? One of the suggestions in the past was to use an extension, the procedure expressed by, I believe it was. And so the conversation is, would systems use the extension, or would systems use a link, if they have that procedure in their system where they can just reference the procedure. So that's one of the things that we will be having conversations about next week.
So Emma, can I interject to ask a question? You reference observations to say that the patient's diabetes is poorly controlled. Recall a conversation that we had about a condition change status where the patient's condition is worsening or improving or stable. So would it be useful to consider also using clinical impressions for that? One of the reasons why I'm asking this is that if we use that as another approach, then we might be able to surface some of the deficits of the clinical impression resource, and so therefore log geriatric change request to have it improved.
Clinical impression.
And just a suggestion for considering also testing it as well.
Yeah, so we can definitely have that, have that conversation. In other words, we will have to, any systems using clinical impression, would this be a good use of clinical impression? That's the conversation that we're going to need to have during the connected time.
Emma?
Yeah.
Sorry, you're not done. Go ahead.
No, go ahead.
So the two new ones there, the addresses service request and procedure, they unless I'm misunderstanding, they seem to be doing what the pertains to goal extension does, right? I mean, if that's what they're intended by, right? Glucose monitoring would be something you would do in support of a goal that existed rather than.
And that was okay. So the change proposal that we got in, that actually was Gay that submitted that change request, was that goal addresses needed to add procedure. I think her example at that time was the patient had a mastectomy, because historical procedures in fire are not typically, I don't know, surgical procedures are used, the procedure resources use that, right? So, so things like mastectomy and gastrectomy and all those kinds of surgery type things, we're supposed to use a procedure resource for that. So somebody who is post a mastectomy, their goal may be to exercise their right arm, or to, whatever goals would be.
Right.
But we weren't able to link the goal to that historical procedure. So that,
okay, I recall that now. Thank you.
Yeah, so that was why we ended up adding goal into the list of procedure, into the list of resources that can be referenced as part of addresses.
Thanks.
There's also outcome reference. We should only reference as observation to kind of show where the patient is at this point in time. You know what I'm saying? So the goal is to control the diabetes, but right now at this point in time, their blood sugar is 315 or whatever, that kind of thing. But yeah, I can certainly ask the consideration for clinical impression, Stephen. Any other questions? So right now within this data set, I have 3 goals. One is for, to stabilize the hemoglobin A1C. The second one is to be able to control her blood sugars, around meal time, because they've been teaching her to eat carb-friendly meals and things like that. And then the third one has to do with compliance and having her keep a carb consistent diet, that has some educational aspects to it as well. So these are the 3 goals that are in here in the data for the scenario. And then condition, of course, she's got a number of conditions. So she of course has type 2 diabetes. And then she has a social issue where she's having problems paying for, finding healthy food or accessing healthy food. So that's a social determinant of health issue, because we're trying to tie those in there. And then she's also having a hard time coping with this diet and the changing diet and the fact that things are not working. So, and you know, sometimes she goes out and because of her inability to pay for food, she goes to like a senior center in the afternoon. She eats whatever snacks they have there to help, you know, with her access to food. So that's another issue that she's having. And then there's some observations, of course, where when they tried, you know, they educate her, explain it for her, there's some lack of knowledge, or limited knowledge about what she's supposed to eat. She can't be eating snacks at the social thing because she has diabetes. And then of course, her diabetes is poorly controlled. Her blood sugars are elevated. And the third observation shows whatever the values are for her actual, this is a laboratory value for her last glucose that was measured. And when I got into some procedures where she's learning how to carb count. So this is like a, to do carb counting. And she's been ordered first, the education thing where there was an order for diabetic education. I believe the service request, it was based on his service request to do a diet education. And this is where there's another linkage where procedures is linked to the service request. And then another procedure for her to do for the blood glucose monitoring. And this is the service request that orders that diet compliance education. So currently that's the data that we have for the connectathon testing. And we will put it in our endpoint. And I'm hoping maybe we can use, with the data spelled out like this, we can use this as well for the clinician on fire so that it will help with our clinical queries that we've been doing on the clinician on fire side. If we can get Dave to give us access to the endpoint, and maybe we can query the endpoint, the MCC endpoint.
Would it list a device if she was using continuous glucose monitoring?
I'm sorry?
If she was using a continuous glucose monitor, would it also list the device here?
We can go into further details as part of I believe it's an observation or something that you can put with the source of where the data came from, or, you know, and where it links, it can reference the device. So we can add that in, but if we had somebody who wanted to come and test their device and see if that can feed data, we can get query and get data from them, we can certainly add it in.
I know that many times in the care plan goals, you put the frequency of the testing. So
yeah,
that's why I was curious. Thank you.
Yeah, so in the data itself, and what I have on these slides, I just highlights so it's not so clunky. But in the data itself, there's the frequency and the dates and all that stuff is actually in the JSON files. So I try to catch, you know, some of that without making it too much, too huge.
Okay, I was trying to reconcile the JSON, which I knew pretty well, against the PowerPoint. So thank you.
Yeah, I just pulled out highlights for discussion purposes and put them in the PowerPoint. But this would be the file that we would actually query to get the data from during the connectathon. If Dave calls and blesses it. Any other questions?
Emma, this is very comprehensive piece of work that you have done. I admire your efforts. A couple of things. Number one, are you going to write out a set of search statements against each of those data points?
So currently, remember hang on. So currently what we are doing is we're using the US core search parameters. And I think I have put some of those in our clinician on fire so people can you all still see my screen?
Yeah.
Yeah. So remember these, so we can use this against that.
Right.
You know what I'm saying? So we have the endpoint and I believe there's a goal, this is in alphabetical order. So there's a goal search. So we can do goal by status because the data is in there, goal by target date. US core doesn't really have a goal reference search. Well, actually there's a goal, the patient reference, but there's goal by description. And that's another thing. So this is something where from Clinician on Fire, where clinicians can say, we want to be able to get the interventions that are tied to a goal when we query the goal. I'm also doing some work on, because of all the linkages in, there we go, in care plan, and we're working on the care plan project. So I'm doing some work. This is where I go to Dave and say, these are the things we want to be able to get back when we query for something, like on a condition. Whenever I query, I want to be able to get, the encounter if there is a linked encounter, because I want to know which encounter this, was this condition addressed during an encounter that just happened a week ago, or was this condition addressed during an encounter that happened 10 years ago? Those are some of the things that people think about when they're asserter. I want to know who asserted, who was the one that made this diagnosis. So I mean, those are some of the questions that that clinicians, that the thoughts that are in your head as in our heads as we try to make clinical decisions, right? Or try to make decisions. So then I'm going back to Dave, when we're in the app, I want to be able to see that stuff. And he's like, yeah, sure you do. But anyway, no, I'm joking, but those are some of the conversations that we're having as to how to make care planning useful, and so that it can really be used during the decision-making processes. Am I crazy to think about it that way?
Not at all.
I do have device. Yeah.
I'm envious of your spreadsheet.
I'm sorry?
I am envious of your spreadsheet because you can track all of the interrelationships
between them, yeah. And then when I got to care plan, that's when I really went on steroids. I'm like, oh, this is where we're gonna really have to hook this up. But this is just, and if I actually do this using the include operation, and then you can also do it using rev include as well. Oh, and Lloyd is coming in, and I'm not going to admit him. Sorry. Hey, Lloyd, can somebody ping you and say come? I don't know if he's on yet.
No, we just happened to get away from FMG, and this is the next place that I wanted to be.
Oh, okay, cool, great. We were just talking about some of the work we're doing with multiple chronic condition care plan. With patient care. So we're talking about references and being able to query and get referenced resource.
Okay.
But yeah, so these are Stephen, to answer your question, these are remember the queries that we were looking at, but these are the ones that are out of the box with US Core, Argonaut, and I think we have some like international patient access queries on here.
Yeah, thank you, Emma. I'm aware of this. And another excellent piece of work that you have done. My question was actually about whether or not there are any missing pieces in here that your slide decks, those data point that you have included might not have covered, and so therefore might worth to be included. But anyway, we can take this offline.
That's the goal of Clinician on Fire, right? So we can find a gap.
Sure,
that's the point, yeah.
Right.
Yeah.
Yep. Okay.
I mean, I think every time we go through this, we find something. Like we found gold data addresses wasn't a query, wasn't one of the parameters last time we did this. And I think US Core has a parameter on gold description, and I don't think description is a parameter either. We have a JIRA to add it though. But it seems like when we go through this, we find things, which is the reason why we keep doing it.
That's wonderful. I am looking forward to the outcome of your technical connectathon.
Thank you. And for folks who are interested, so next Thursday, May 5th, 4:30 to 6:30 is when we're doing the clinician on fire. And like I said, the same scenario we're using in the technical connectathon is this scenario, I believe it's scenario 5, scenario 4.
Track 4, yeah.
Yeah, it's the same scenario that's being used here.
Emma, I have a request on those slides. Is there a place to just take them and where I could find them? Because just as we copied what for Kaylee on the persona, it would be good if we just followed that same format for for the journey. So if you could point me to those slides, that would be great.
Yeah, so what I'm going to do is I'm going to add these slides to our presentations deck that we're using today. At the end of this meeting, Savannah usually will send out the meeting notes and the recording and everything with links to the slides.
Great, thanks.
Emma, I'm actually thinking about having this slide deck on the Clinician on Fire conference page track 4. So therefore, it gives also a good convergence point for people to look at as well.
Yeah, I'll add it there as well, Stephen.
Okay, thank you.
But what I'll do is I'll add it when we do Connectathon, after we do Connectathon. So if we find anything in addition, then I'll update this and add it there as well.
Yep, wonderful. Thank you.
And
all
I'll
right, I
also
think
as well.
Anything else on what you want to discuss today? Otherwise, I think we can give Lloyd a few minutes. I think he come here to talk to us about a project that he wants to start.
Karen, do we have anything else on our?
Just the work group meeting, but that's not urgent.
Yeah, the work group meeting planning. Okay.
Well, we can come back to the work group planning. I think my understanding is Lloyd only needs about 10 minutes. So we still have a bit more time. So after Lloyd, if you guys don't mind, we can talk about the work group meeting arrangement after Lloyd's discussions. Would that be okay?
Yeah, that would be great. Thanks.
Okay.
Thanks.
All right, Lloyd, over to you.
Sure. Well, Lloyd's primary ask was actually some time on your working group meeting agenda, so that the project proponents can talk to you. But I can talk briefly. Basically, the Physical Activity Alliance and the American Heart Association has secured some funding to move forward a project. The objective is to allow practitioners to gain access to information about and record in a standardized way information about patients' physical activity level, create plans to improve those, including possibly ordering interventions that will help a patient to appropriately enhance their physical activity levels and